touch the shoulder to the wall and reverse that motion. Here and then hip. Okay? To bring this back to sport and the relevance of this test and the challenge of this test, if we look at a lot of overhead athletes, volleyball players, tennis players, even basketball players as they have to go back, sometimes they have to get into this position where they're on one leg. So for instance, tennis, they got to get back on one leg, be able to rotate and come out of it. Okay? Volleyball players, they have to come out, so eccentrically rotate and then come back through. So we're challenging the system even more with this test. Okay? With this test, as you come back, you're going to get a little bit of rotation and extension. That's okay with this test. So when we look at the that's okay. When we look at this test for the criteria page, what we're looking for is controlled motion. Can they actually control and sequence? So again, first motion is rotating through the hip. Okay, the hip moves, then the trunk, and then that eccentric control to the wall and back off. What you don't want to see is one piece and falling into the wall and pushing themselves back off the wall. Okay? This is for more higher end athletes and patients that you're going to do this. What you want to start to take note of is which side do they move better in. And again, if they're an athlete that only moves in one direction, golf, tennis, oh, I just lost my voice.
It's okay, man. It's the last day.
It's too much oolong tea. Yeah, so you'll notice with these athletes, just like the other rotational tests, you'll notice they'll rotate better in one plane. The key is the setup. Feet together, because if they're here, they're going to already shift. Short foot, hands across the chest, rotate towards the down leg, hip, trunk, wall, and rotate back out through that test. Okay? So again, we're challenging that eccentric rotation now. So like we did with the Nordic, or the reverse Nordic, we were challenging that eccentric movement. Now we're adding a rotational component to this test. Okay? So that is, as you can tell, the eccentric trunk rotation test. Okay. Hey Rob.
Yeah.
You want to do throws pose?
Sure.
Okay. So again, this next test, very specific, more for baseball players, but you can also use this for volleyball players, tennis players as well, and play around with the feet position. He's going to talk.
Yeah. So this test was created partially because the way the shoulder rotates, the way the shoulder rotates is not actually pure glenohumeral rotation. It's not this. Okay, external rotation doesn't actually truly occur that way with normal physiological function. Right, number one. Number two is it's actually a joint couple. This joint couple with rotation is actually when you turn your pelvis before the trunk, it actually allows you to set the shoulder blade, and as you rotate the trunk, what you end up getting is an adduction of the humerus that actually allows you to rotate the humerus. Right? That is how the shoulder rotates. It does not rotate up and down like this. Alright? Because it's contextual, and the way that the interaction between your trunk, shoulder blade, and the shoulder occur require a sequence. Meaning that you've got to move a lower segment to load the upper, so that way you can actually move the most distal segment, which is through here. So with this thrower's pose, we actually start to instill that. Do you actually have good physiological external rotation? Alright? We're not measuring it. What I want you to be able to do is, do you actually have good quality of that range? So yes, it's high quality and very specific to throwers, but it actually gives you a lot of information about general mobility of that shoulder joint itself. Alright, so you can call it a thrower's pose, but it's really dynamic rotation. Alright, so the way it's going to work is with Brian here.
So with the athlete, obviously, you're going to go to the hand that they throw it, they use.
So I'll show you two ways of how it rotates. So watch Brian's shoulder here. Relax. Okay. See how if you keep the shoulder in line, he doesn't like that very much, right? I'm cranking on it just to get that the facial expression, right? It'll go because he's got some mobility, but he does not like that. Okay? Here's the point to it. If I pull his elbow forward, look how much his elbow drops. And he's actually feeling okay. Alright, so the idea is to get that adduction moment, your shoulder blade has to be set. Okay? So what you do is you get him to turn his pelvis, which is that pelvic dissociation. Alright? And then what you get him to do is now try to turn the trunk. As he turns his trunk and force the elbow forward, you see the hand drop. Alright, that's what you see in a lot of people that have a lot of external rotation. It's because the elbow, relax, goes into adduction. Alright? So we can actually rotate. What is the normal position for shoulder function? It's called scaption. That's out here. Right? All I'm doing is getting to sit here, keep that position, and you've done this. So that adduction is actually placing the shoulder into neutral when you rotate the trunk. That's all we've done. Yes, throwers need it the most, but people in general need it, especially if they're up here. You've got to move the elbow and then the hand. Most people who have shoulder problems in overhead activities, they move when they get up to here and they got to turn. So he's turned his pelvis. They move the hand and then the rest of the arm through with whatever they're doing. Right? The idea is lead the elbow and then create the hand motion. You create speed that way. Alright? Because that whip effect, and all you got to think of is that slingshot. If you pull back on it and let go, it'll actually have a lot of speed. If you sort of set it up so he turns his pelvis, he adducts, that is me doing this with the slingshot. And then you let go, and you create speed. Alright? But the idea is, if you're only doing, so for therapists, if you just did external rotation this way, he's not going to like it. Right? He's fighting me on it. Alright? And you don't get a full sense of external rotation until you actually go into adduction, and next thing you know, his arm drops. His trunk is tilting into it, but he's not stable. Alright? Is your shoulder bothering you?
No, not yet.
Okay. But the idea is put it into scaption or adduction to actually create external rotation. Okay? But you've got to create that dynamic motion to create external rotation. Okay?
So with this test, you're going to set them up. You're going to put one hand on their
one hand, yes.
And then the other one's going to be lightly here. What you're looking to see is, with this test, like we did with the wall rotation test, is the chest is going to try to point forward. So again, we're looking for the dissociation between that lower and upper. Okay? So it's here, and what you're going to tell them to do is turn their belly button or their belt buckle as far as they can. They're allowed to pivot on that back foot and come through. As I'm turning, the assessor is going to add just a little bit of horizontal adduction through. What you're looking for again is quality of movement. Are they getting the rotation through the thoracic or through the TL junction? And also, what we do is, as a therapist or even trainer, you always ask them, like, are you feeling tension with this? Okay? Because if they're feeling a tremendous amount of tension, and as the assessor, you'll feel it because you'll feel the hand push back into you. You got to take note of that. All right?
This one has no palliatives. Okay, this one is either they can do it or not, and can they sequence. Alright? But your other tests, your other rotation tests, will have provided information about this. If the other rotation tests they have not done so well with, this test is not going to go so well. Okay? So, just be cognizant of that.
Don't kill people's shoulders. Try not to. So, we got the eccentric rotation, leg up, hands crossed, rotate So you reverse it, and then we got that pitcher's pose. So set up, pelvis will allow for that external rotation, and again, you want to see the 50 to 70 degrees dissociation with really no tension. There should be no tension. So when you're working with baseball players, tennis players, there shouldn't be any tension with that. It should be nice and easy to move it around, as you saw the difference from the first two positions.
So do it both ways when you rotate the shoulder back. Don't move the elbow forward and see how much range you get, and then move the elbow forward and see how much give you get. I want you to appreciate those two states, okay? And also too how the person feels, all right? Because if it's in the right position, the body lets you do it. If the body's not in the right position, the nervous system doesn't let you do it, right? This is a good example of that principle.
And one more thing, a good exercise for this is what we did this morning. Remember, we were on our stomachs, came up, brought it up, brought the elbows down. When you brought the elbows down, you were bringing your humerus into that horizontal adduction. So it's the same thing. So if they're feeling tension or you do your soft tissue therapy, that exercise is a great one to give them after in order to build up some of that tissue resiliency and some of that adaptation within that motion. Okay, so you start kind of linking things together. All right, so let's spend about 7, 8, 10 minutes doing these two protocols.